The state's health plan was under attack today in federal court. The question is whether it violates the rights of transgender workers. WRAL's Julian Grace listened to the oral arguments from both sides.
The plan just simply not interested in that.
What are you interested in then?
It was a back and forth argument inside the U.S. Court of Appeals for the Fourth Circuit. And the North Carolina state health plan is on the defense.
It's not accurate that we don't cover anything.
No, I'm using your words.
A lower court ruled North Carolina violated the rights of transgender employees. The suit represents former state employees and their children who say they were denied coverage for hormone therapy, counseling, and health care related to gender transition. But attorney John Knepper, representing the state, doesn't agree and says no one gets gender-affirming care.
Every beneficiary in the North Carolina state health plan receives coverage for the same health risks. This is no less true for plaintiffs who are transgender or the parents of transgender individuals who receive the same coverage for the same health risks.
Here's what's just wrong about that. Sure, if a transgender person has a broken leg, the health plan will treat that. That doesn't explain why they're discriminating in this very key, very important way against transgender people, denying them the same care and treatments that cisgender people receive as a matter of course.
That's Tara Borelli. She argued on behalf of several current and former state employees and their children who are transgender. She says the current state health care plan makes a difference between transgender and non-transgender.
It ignores the fact that this singles out transgender people for exclusion. They're trying to pretend that the exclusion of gender-affirming care that transgender people need, that it just treats everybody the same. But that's not the case at all. This singles out transgender people and it denies the care specifically that they need.
That was Julian Grace reporting. We reached out to the state for comment, and so far we haven't received a response. No timeline was given on when the U.S. Court of Appeals will uphold or overturn the lower court's decision.